In this training, we're going to look at the topic of grief and loss in counseling. I believe this is one of the most important topics to deal with because you will have many different clientele coming through to you dealing with this issue. And so we want to spend some time today looking at the topic of grief and loss and see how we as therapists can help our clientele to work through these problems. One of the first things I think is important if we're going to be doing any type of counseling, especially for grief and loss, we need to have a working definition of what we are looking at. And so as we define grief today, I like to use the following definition. As we define grief as a normal response to the loss of any significant person, object, or opportunity. I think it's very important for us to define grief this way. Many times when people look at the topic of grief, we spend most of our time focusing on someone who has died or passed away. While in many cases this is true, in this training we also want to look at another aspect of it, is that when someone has lost an opportunity or also an object as well, they too can grieve and go through a process of grief and loss. And so we want to make sure we extend our definition this way to make sure we're all on the same page and talking about the same thing. And so we'll be using this as our working definition for this training. In a book, Loss, Trauma, and Resilience by Pauline Boss, she describes grief this way, that even without death, the people we care about disappear physically or fade away psychologically. That there will be some situations in which your clients will get into, that they themselves will find people who are in their life who have not passed away, who are still living, yet for one reason or another they are disconnected from that person. And in those situations, we have to figure out the best way of helping our clients deal with the grief they're going through. In a few minutes, we'll talk about some different things that people grieve about, especially when we talk about relationships that end for one reason or another, or for some reason or another, the people are physically separated from each other. We want to spend a few times looking at that as well and figuring out why people grieve in these types of situations and what we can do to help them to work through this grief process. So once again, we want to expand the viewpoint of grief as not just surrounding someone dying. Now, when we think about things that we grieve over, many different things come to my mind. One of the most common things that people think about is the loss of a loved one through death. That for one reason or another, someone has been separated from us. It could be a grandparent who we were very close to, or maybe a spouse we've loved that has gone before us, or maybe we have lost a child. But some situation or another, we find ourselves grieving over the person who is lost. And sometimes we are really not sure how to deal with that. We're not really sure how we want to move on in life without them. And we'll spend some time in this training talking about how we can do that. But sometimes people do grieve over a lost loved one. Something that we're beginning to see that more therapists are spending time focusing on is the grieving process of divorce. Now, for some people, this may be a new ideology to wrap your mind around. But when we consider divorce, you have two people who have been in a relationship for a very long time, who they've come to know each other. They've shared secrets with each other. They have shared sexual intimacy. But for one reason or another, these two people are no longer in a relationship with each other. And so when this occurs, you have someone who has not died, but yet you're no longer with that person. Or that person has moved on and got in a relationship with someone else. And so you have this divorce that you're now trying to deal with. You grieve about what it could have been in your relationship. You grieve about why things have changed, why you're no longer together with that person. Why does that person not love me anymore? And so these are the questions that are going through the mind of someone who's going through a divorce. And so rightly so, they are going through a grieving process. Also, the retirement from a job. There are individuals I've met before who have basically put all their identity into their job. They spent 20 or 30 years doing a particular thing. People have come to know them because of that job. And then once they retire, they really have a lot of questions about what would they do with their life now. How do I move on and how do I re-identify myself in this world? How do I reconnect with my family now that I'm no longer in this job? And so there's a grieving process that they will go away from. Maybe their importance came from the job and now they have to seek that someplace else. So maybe when there's retirement from a job, we see that grieving process begin. I've also heard from people who are maybe in the military when it comes to the amputation of a limb, how that can be an issue for some of them as well. Or there's things in their life where they were at one time were able to do. Maybe it was just basically being a soldier, being able to walk around, the things they were normally accustomed to doing. But now that they have lost a limb, they're not able to enjoy their life in the exact same way they'd always done. And so this is a process of grieving as well. Now, it does not mean that their life is over. It does not mean that they're not able to continue on with their life. But adjustments now must be made, and they must learn how to grieve appropriately. Also, when a child leaves for college, many parents go through what we call the empty nest syndrome, where the nurturing process they brought their child through for 18 to 20 years is now rapidly coming to a close. The child is now making decisions for themselves, and so the parent must now once again readjust their life. And they begin to readjust. And as through this readjustment process, they begin to grieve over their child not being in their home anymore. For those people who are athletes, they spend a lot of time and energy and training for these events that they're going to be a part of. Whether it's a basketball game, a football, or some other type of sport, many hours and sweat have been poured into competing at the highest level of their ability. But when they go through these events, they're not able to win in the way they wish, or the game doesn't go the way they want to. Once again, they grieve over losses. And once again, as therapists, we must take these ideas seriously and help them through their grieving process. One thing that we see many people face, especially as they get older, is some of the health difficulties they have. That their bodies don't work the same way that they used to. And when these situations occur, there is a grieving for their younger years, grieving of what in the world they do with themselves now that their body does not work the same way they used to. Or now they have medications they have to take every single day just to get out of bed. And so there's a loss in their life of something they were accustomed to. Or maybe you have someone, because of finances, have to move to a neighborhood that was different from where they grew up, to a place where they don't feel safe anymore. And so this loss of security, this loss of safety in their life has now been taken away from them. And once again, the grieving process goes. And so I think the best way to really summarize up this slide here is to basically help us to see is that any time when a person loses a part of their life or is taken away from them, we will see grief and loss going on. And it's in those times that our clients need us to be aware of how to help them and how to allow them to work through that process of grief and loss. What we want to do now is look at 3 particular types of grief and give you a couple ideas of how to work through these griefs as you deal with your clientele. The first one is what we call anticipatory mourning. And this is when a person or family is expecting death and they begin to anticipate how one will react and cope when that person eventually dies. I've heard situations before where someone was not feeling well. They go to the doctor to find out what's going on wrong and come to find out they have a cancer that's inoperable. They now have only 3 to 6 months to live, and in this time period they have to begin to wonder and figure out how they're going to deal with the rest of their life. How I discuss the situation with the family members who love me and the people who care about me. And as their family members hear this news, as it catches them off guard, the process of mourning begins immediately. The family members are now forced into a situation where they have to be able to deal with this person's passing and loss, even though it may be a few months or even a year away. And what we're beginning to see is that when people are able to grieve before the tragedy happens, when people be able to begin that process even earlier than a sudden loss, which we'll look at in a few minutes, we're seeing that people are able to deal with grief so much better because they've had some time to process it. They've had some time to say goodbye to their loved ones. They've had some time to really work through this process of grief. And so if possible, I want my clients to have as much time as possible to work through some anticipatory mourning, that we'll encourage them to talk about the loss before it happens so the grieving process will be something that they can actually grow from. A second type of grief we want to look at is what we call sudden loss. This is a sudden, unexpected loss that may exceed the coping abilities of a person, which often results in feelings of being overwhelmed or unable to function. We will find clients sometimes where they maybe have a loved one who have suddenly passed away. And although the reality of this death is something in their mind, they still are caught off guard. I believe one thing as children, as we grow up, there's an ideology that one day our parents will pass away. We know that day will come. But I don't know if many people are still prepared for it, even though it happens on a daily basis. And so when this happens to people, when they have that lost one go away in their life, or the loved one goes away, they may find themselves in a situation where they feel overwhelmed, that they weren't prepared for this loss. Maybe there were some things they did not get to say. Maybe there was more time they wanted to spend with this loved one, and they're not exactly sure how to deal with this grief. And so maybe for them, life goes on pause. Maybe for them, life shuts down temporarily because they surely are not able to understand how to function. And so we will find our clients in this step of grief where they will basically have a sudden loss and not really sure how to deal with that. And so we want to help guide them through this part of grief. And the third and final type of grief we want to look at is what we call complicated grief. This is an intensified, delayed, or otherwise debilitating grief that keeps the mourner in bondage to the deceased person and prevents one from coping and moving on with life. In this type of situation, as we talk about complicated grief, what usually happens here is there is some type of tragedy that's taking this loved one away. Maybe this person has died in a car accident. Maybe it's the death of a young child. Maybe someone is murdered or drowned or something to that effect. But there's some type of tragedy that's attached to this person's death. And because of this, it catches everyone off guard. And because of the nature of this person's death, the mourner simply does not know how to move on with their life. They're not sure how to look at life from this point forward. How does life go on once you have lost your child to a tragic car accident? How do you continue to move on when you have twin babies who are stillborn? How do you deal with that? And so this becomes complicated grief. It's something that's not expected. It's something that takes a little bit more time to deal with. And so there will be situations where you have people coming in with complicated grief, and yet we want to be able to help guide them through this process of mourning and loss to see how they can deal with it. And so as your clients begin to come in, you want to try your best to put them to one of these three different categories to see whether they're dealing with anticipatory mourning, sudden loss, or what we call complicated grief. What we want to do now is spend a couple minutes looking at the different effects of grief. What does grief look like in the life of a client when they walk in? One of the first ways we can see this is in physical aspects of grief. That in some of our clients you will see a change in appetite which equates to a change of weight. And some people, they may begin to eat more because of anxiety or worry about the situation, and because they consume more food they end up gaining more weight. But in some people's cases the exact opposite happened. They have lost their appetite. They simply do not want to eat. And when that happens, they begin to see some drastic weight loss. For some people, you'll see them having sleeping problems. On one end of the spectrum, you'll see people who basically have no desire for life, and so they end up sleeping way too much, and the physical grief is taking them over. Or they're not able to sleep at all because their mind continues to wander, their mind continues to race, thoughts going in and out of their mind, and they're not really sure how to relax, and so they cannot get any sleep at all. Some people even discuss having headaches or some type of physical ailments and physical pain from their grief. And so when someone is hurting physically and emotionally from grief, we're going to see some outside effects of that. And so as therapists, we want to make sure we're giving a good look out for that. Not only is the effects of grief physical, we also see some emotional effects of grief as well. I worked with clients before when I've been asking that simple question of how are you feeling about this loss you've experienced. Some of them will acknowledge that they have a numbness going through their body. They simply don't feel anything at all. They're not happy, they're not sad, they're not angry. They simply do not know what's going on with themselves emotionally. It feels as if I've heard this statement before, that I feel like I'm kind of in a movie right now. I'm kind of watching myself. I'm not sure what's going to happen next, and I don't know what to do. And so when this happens, once again, you need to have someone to be able to attach with their emotions there to hopefully be able to express something. But this numbness may be something that happens for a short-term period. Also, you have clients who experience sadness. Maybe it's a light depression there, maybe it goes even further than that. But a sadness where they simply cannot put their finger on it. That no words can console them, nothing that can be done to them can change their mindset, and they simply do not know how to deal with this loss. Another thing we see is anger that can build up. This emotional discharge of pain that they're trying to get rid of in their life. There can be situations where maybe you have a religious client. They may find themselves angry at their God or angry at their higher power and are not really sure what to do with it. Maybe this anger is internalized and they're angry with themselves for maybe things they did not do in a situation or with this relationship with this person. Maybe it's anger with this person who just now passed away and they're simply not sure how to deal with it. But anger can be an emotion we see expressed. Also, there will be clients who are experiencing guilt, wondering if there's anything they could have done different in their relationship with that person. Maybe they feel like they have not forgiven that person or something to that effect, and because of that, guilt is reigning in their life and they're not sure how to deal with this emotion. Sometimes we have clients who deal with anxiety, where they begin to worry. Well, my same results in my life happen the same way for this person. How do I deal with this anxiety in my life? For other people, we simply see apathy, where they simply don't care about anything else in life. Life simply has no flavor to them anymore, and they're basically taking a time out emotionally from everything, where they simply just do not care. And then we'll have those who will simply try to abandon emotionally, where they simply don't try to care about anything whatsoever. Because when you care about something, then you have the ability to lose something. And because they're tired of losing things, they simply don't want to have any type of emotions. So they're trying to abandon everything. And so this is a small picture of emotionally what people are going through when they deal with grief. Also, do we see a social aspect to this grief, where someone can seem to appear on the outside overly sensitive, that anything you say can put them into a bad mood, or at any point of the day you find them crying over just about anything, where their sensitivity to life may be heightened for a shortened time period. Or you can see someone who may normally be independent, doing things for themselves, where they instantly become dependent. They're looking for more people to step in and help them with their life and in order to walk through things they're trying to work on. Some people also find themselves being withdrawn, or all the things they used to do, they find themselves stepping away from them. Hobbies I used to be a part about, parties and things I used to go to, places I used to go, I find myself not doing that too much anymore because once again I'm in this process of grieving. Now on a short-term basis, this may not be a bad thing. This person simply may be trying to find some time to themselves, find a place to redefine themselves. But this is happening all the time, then we do have an issue there. Or the person can have a lack of initiative, where they simply don't feel like doing anything at all. And so it's important to pick up on some of these social cues to see if this is affecting your clients. Also, we see there are some spiritual effects of grief as well, that for some of your clientele who may be religious in nature may look at this being a positive thing. From their viewpoint, they may be thinking this person is going on to a better place where there is not any more suffering for them. And so this can be actually a good part of the grieving process. But there also could be a negative response as well if they're angry once again at their God, or angry about their higher power or whatever they believe in spiritually. And so they could have a spiritual aspect as well. And so as therapists, we want to make sure as we think about our clients who are grieving to take into account the physical, emotional, social, and spiritual issues they could be dealing with as they're dealing with the grief and loss. Next, we want to look at some of the factors that influence our reaction to loss. I've been amazed in my time of therapy that there can be two people who go through the exact same situation, but for one reason or another, they react to the same situation totally different. And we want to look at a couple of reasons why this happens to people. One reason is this prior anticipation, which we looked at just a couple minutes ago. That if someone has an idea that something's about to happen and they have some warning before it happens, for some reason they are able to deal with that better than someone who is caught off guard. And so if possible, if there's prior anticipation, giving them an opportunity to speak about that at first is very helpful for them in this process of grieving that they're going to go through. And so prior anticipation helps out quite a bit. Also, the type of loss makes a difference as well. For some people, when they lose a spouse versus them losing an animal, we see the reaction being quite a bit different. This is not to say that they would not be upset in both these situations, but the time in which they grieve seems to be shorter depending on the type of loss they're going through. And so I think it's important for us as therapists to make sure as we are talking to our clients to see if the amount of grief this person is showing actually matches up to the type of loss. Imagine me losing a video game and me being upset with that for 6 months. Obviously, the type of loss does not match up the amount of grief I'm going through. And so once again, I want to make sure I look at that. Also, the personal belief system as well. What viewpoint does this person have about this loss? Maybe someone looks at this loss as an opportunity for growth. They're going to look at this situation totally different than someone who is pretty much a negative person all the time. And so their belief system on this loss can definitely change the way in which they look at it. Also, whether or not this person has, once again, some religious type belief attached to their loss that can once again have positive or negative effects on them. And so being willing to answer those questions and to look at that can help us to see why this person dealt with this in a good or a negative way. And also social and cultural environments make a huge difference. One thing I've noticed culturally between different racial groups of people, that we look sometimes at loss, especially of people, differently. In some racial groups, you can see a loved one dying maybe on a Monday, and by Wednesday that week, that person is already being buried. And in that short time period, they are already expected to go through the grief process and to basically be over with in a very short time period. Where in other contexts, you'll see other cultures, someone may die, and it may be over a week before the person is buried, and they look at the whole process of death as being a celebration of this person going to a better place. And so, being good multicultural counselors, as I know we all are striving to be, we want to look at the cultural background of our clients and get a very good understanding from them. How do you view loss? How do you view the end of life? And I think those insights will help us make better decisions with our clients. And so it's important for us to realize that everybody experiences loss different. Everyone is unique. And as we're making our diagnoses, as we're making our treatment plans, let's keep that fact in mind to remember that everyone reacts to loss differently. And also the last point we want to look at as the reaction to loss is the mode of death. That once again, depending on how this person has passed away, we're going to experience that different. And so if someone ends up dying once again in a car accident, or if a 90-year-old person basically passes away in their sleep, we're going to look at those, we're going to react to that different just because of the mode of death. And so we must keep that in consideration. Now in this next section, what we want to do is spend a couple of minutes here looking at some of the worst things to say to someone who is grieving. One of our jobs as therapists is to be able to help our clients work through some of the problems that they are dealing with, to help provide choices for them in life so they can make better decisions with their life. One issue that happens sometimes as therapists, there can sometimes be a need to always say something in a counseling process. I think it's important, though, if we're going to say something as someone is grieving, experiencing loss, that the things that we say need to be things that are encouraging to the client and not discouraging. Ethically speaking, we don't want to do anything that's going to cause our clients harm. And I believe there are some very good intentioned therapists out there who want the best for their clients, but sometimes the statements that are made in the counseling sessions end up hurting the clients more than helping them. And so we want to look at 10 statements here that can definitely damage your relationship with your client while they're going through the grieving process. The first statement we hear sometimes is, "Call me if there's anything I can do." Now, on the outside looking in, this seems like a very good statement. It seems like the people who make this statement are being sincere, that they are looking out for the best needs of their client. The problem is many times clients, as they are grieving, they are not really reaching out to other people. Sometimes they're feeling like they're a burden on other people. And so for them to ask for help during this time period may not happen. And so what ends up happening is a good gesture is made for them to call if you can do anything. But the reality is most clients will not end up calling in that time period. And so what I think may be better in this situation is to ask if this client has any specific needs that need to be taken care of. That maybe if you have a case manager working with you or something to that effect, maybe they can try to reach out to them on some specific needs that are made versus a blanket statement of call me if there's anything I can do, because many clients will not respond back. Another thing that sometimes is said is, I know just how you feel. Once again, this is made with good intentions. I think it's a part of why some therapists try to join with their clients by making a statement. But the reality is, regardless if you go through the exact same situation as some of your clients, you're not going to know exactly how they felt. Because once again, we've already covered the fact that we experience grief and loss different from each other. So I will never ever be able to know exactly how someone else feels in a situation. And sometimes we'll make assumptions that are dangerous. So it's very important for us to make sure we ask our clients, how are they feeling in this situation, but never assume that we know what's going on with them, because we could be making a very huge mistake. Another statement that is very hurtful, I think unintentionally, is you can always have another child. It's almost as if, this child you had was not that important. You are able to do this once again, so you really should not be grieving that much. And so once again, this statement, very, very cruel, is stated in order to help, but I think it ends up doing more damage than anything else. The fact, biologically, yes, maybe they are able to have more children, but they're grieving the loss of that child. They're grieving the loss of someone that they have brought into this world, someone they have nurtured, someone they have loved, someone they have cared for since their birth. And so this type of statement ends up being extremely hurtful and harmful for someone who's just lost a child. And so finding something else to say here would be a lot more appropriate. Or simply, it will get better. Basically what we're trying to tell them is, don't really freak out right now. Things are going to get better. The reality is things may get better down the road, and maybe in the back of the mind the client realizes that things will get better. But for right now, that's not what they're wanting to hear. They want an opportunity to grieve. They want an opportunity to talk about what's going on in their life. And for us to simply tell them that things are going to get better, we're shutting down an avenue for them to be able to express what's going on in their life. So simply telling someone that it will get better simply is not good enough. Or you are young. You can get on with your life. Once again, it chalks up their life experience as something that is normal to everyone else. That you'll get over this. You'll get past this. We'll rush you through this grieving that you're going through right now. Get on with your life. And I believe this is, once again, a statement made to help, but once again, you can see very easily how that can harm someone. For some reason, I feel like we're in a part in our society where we don't want people to grieve long enough. As soon as someone begins to cry, we immediately hand them a tissue because we're inadvertently telling them to dry up their tears. That when someone dies in the workplace, employers usually give them 2 to 3 days off to grieve, because that should be enough time for you to get over a lost loved one. And so we're basically telling people here to get on with your life and get along with it quick. I believe there are much better statements to use in this. Also, the statement that time will heal all wounds. Now, this doesn't work physically in our life, and it also does not work emotionally. That there are things in life that people have been wounded by that they may never heal from. That there may be some places in their life that have been scarred because of this loss from being given away, and just because time has passed since the event happened, it does not mean that time is going to change anything. And so for this client, it may be better to help them see that as time goes on, maybe things could get better. But the reality is that, once again, we cannot make a guarantee here that time in and of itself does not fix anything. Also, you should be over this by now. In our own mindset, we're kind of summarizing what we think is a normal amount of time to go through pain and suffering. That there's almost like this chart that we have written out, that for certain wounds in your life, here's a certain time period. You know, if you stub your toe, 3 seconds should be enough grief over that. If you lose a family pet, a month should be enough time grieving. And so mentally we kind of have our own list of when people should get over things, and we end up imposing that over them. And what ends up happening is these people end up feeling guilty longer because they feel like there's something wrong with them because they're not grieving correctly. And so we want to make sure we're doing this on their timetable and not necessarily on ours, but simply saying you should be over this by now is not allowing them to grieve in a proper manner. Also, we may say, don't talk that way. You know better than that. This is simply a way of shutting them down from expressing themselves emotionally. But what's happening here is we're feeling uncomfortable. What they're saying is putting us on edge. What they're saying is not comfortable for us. But once again, in the field of therapy, we're not here for our own comfort. We're not here for our own healing. We're there to help them. And so once again, we have to be comfortable with them speaking that way and discussing their emotions, because once again, that's why we're here to help them. And so allow them to talk whichever way they need to. Also, you must be strong. I would die if that happened to me. Once again, we're putting our own comforts, we're putting our own life situation in the mix here, and we really need to have that separated. Once again, we want to look and see how are they dealing with it. And if they're dealing with it in a healthy manner, we don't need to put into the mix how we think we would have dealt with that situation. Because at the end of the day, how we would have dealt with it really has nothing to do with it whatsoever. We're here to see how our clients are dealing with the situation, and we want to help them through that. And finally, look on the bright side. It could have been much worse. Once again, there is truth in this statement that the situation could have been much worse. But where they are right now, they are hurting. Where they are right now, they are in pain. And so because of that, we don't want to make that pain worse. And so almost once again discounts the pain and suffering that they're going through, because we're trying to acknowledge that it could have been a lot worse than what it was. And so these are just 10 of some of the worst things to say to someone who's grieving. I'm sure there are many more things out there or different variations of these 10 statements, but I at least wanted to bring these to your attention for the purpose of this training. Now I want to spend just a couple minutes here looking at Elisabeth Kubler-Ross's Stages of Death and Grief. This is some of the great work that's been out for over 40 years now. We want to spend just a few minutes here talking about what her viewpoints were on the stages of death and grief, and look at how we can practically use this with our clients. In this first stage here, we look at what we call shock and denial. And this is when the patient's initial reaction is shock, followed by denial that anything is wrong. And what I think is interesting about these stages of death and grief is the person who's experiencing death, they go through these stages, and their loved ones can be going through the same stage at the exact same time. Then maybe the person's going to the doctor because they were not feeling well. The doctor runs some tests, and they find out that once again they have this inoperable cancer that they're dealing with. And now this person has to make a decision, do I tell my family, do I not tell my family? And they do tell their family, and you know what, they're still in denial. We know if I go to another doctor, a different doctor may give me a different opinion. And so they go to a third, fourth, fifth doctor, everyone's still saying the same thing, and they're just in a denial that this could actually be them. Maybe the doctor's looking at the wrong test results. Maybe this is someone else they're thinking about. But for some reason or another, this person's in the stage where they're simply in denial. And the problem with them being in denial is that they're not allowing themselves to actually grieve what is about to happen and the process they're about to go through. And so I believe the sooner they're able to deal with this, not only the person who's dying, but also the person who is grieving their upcoming loss, the better they'll be able to process this information. The next thing is what we call the anger stage. And this is basically a frustrated outpouring of bottled up emotion. For the grieving person, maybe they're angry at the person. This person's been smoking their entire life, and now they have lung cancer, and they're just upset with them. How could they do that to themselves? Or maybe they're angry with themselves. Is there anything I could have said or anything I could have done different to help this person out? Maybe this person's religious, and they have their God that they worship. They are angry with that God, and they're upset with that God. And so because of that, they simply don't know how to deal with the situation they're in. So in this anger, they may say or do things they would have never done in any other situation. And so we want to help our clients to identify whether or not they're in this anger stage and realize that this is normal for them to experience. Another thing is what we call the bargaining stage. Now in this bargaining stage, what we see in many people is they seek in vain for a way out. That they may be negotiating, that maybe if I'll exercise now, maybe if I do some different life changes, maybe this will not be the end result. Maybe the doctor can give me a second opinion if I do some certain things in my life. And so maybe once again they're arguing with their higher power, whatever the case may be, on giving them more time in life to maybe correct some things that they want to have done right. And so in this bargaining stage, you see frustration, you see anxiety at its best, because these people simply do not know how to deal with the process of dying, and they're doing everything they can to hold on to some semblance of normalcy in their life. Another thing we see people go through is a depression stage. And this is the final realization of the inevitable, where clients begin to show signs of withdrawal and hopelessness. And so here is, they realize, I've only got 2 months left with my life. How am I supposed to deal with this? I have a loved one who is dying right now. I feel like I can't do anything at all. I visit them every single day. I watch them on their bed, taking almost their last breath every single day. How do I deal with this? And these people may seem helpless. They may feel like there's nothing they can do whatsoever, and we see some depression setting in on their life. And so when these type of situations occur, when this depression is working itself in, we want to work with them so this depression does not become clinical. We want them to help them through this stage as well. Also, there's the acceptance stage, and this is finally finding the way forward. In the acceptance stage, we're not saying that the person is okay with the end result, but what we are saying is that they find a place in their life where they can move on. I will make final preparations for my death. Or I've accepted the fact that I'm going to lose my mother this week. What can I do to make her final time on earth comfortable for her? And so we want our clients to work through to the acceptance stage, even though this could take a lot of time. One thing that is common for many people is that sticking and cycling is a common problem. That people don't necessarily go through these stages in the exact order, and sometimes they cycle through them. Where someone may be in shock and denial for a couple of days, go to the depression stage for a couple of weeks, and then go to the anger stage. And so as your clients are experiencing these emotions, going through these stages here, we want to help them to know that this is normal, and to help them see what they can do to come out of this cycle. Next, we want to look at the work of psychiatrist Dr. Worden. He has worked in several different hospitals. He even started the movement of hospice that we have here in the United States. And what we want to do is look what his 4 goals of grief counseling were and see how those apply to the counseling world. One thing we want to talk about is, he says we need to do is to accept the reality of loss. That in this life there are things that we are going to lose, and sometimes there's simply nothing that we can do about it. The only thing that we really have control over is how we react to that. And so one of his main points is we want our clients to accept the responsibility for their loss. That if they are hurting, if they are grieving this process, that is okay, but the reality is they have to adjust their life to realize that things are not going to be the same. I believe this is probably one of the most difficult steps to take, because for many people reality is very harsh. For many people reality is not something they want to deal with. And so we have to help our clients to accept the reality that they're going to be losing something soon. Also, to work through the pain of grief. To help them to see they're going to be at different places emotionally every single day. There'll be days when they are feeling physically good. There'll be days where emotionally they're not doing well. There'll be times when they're going to feel dependent. There's times where they're going to feel irritable. And all of this is the pain of grief in which they are experiencing. And so when these things are happening, we want to be there for them to help talk them through this process so they can know exactly what's going on. Also, to adjust to an environment in which the deceased is missing. What we do here is help them to start planning their life, to look forward to what's going to happen when this person is gone. Now, once again, this is not comfortable. This is not something that every person is going to want to do. But the reality is that life is going to adjust, whether they want it to or not. So in these situations, we want to help show them how they can get prepared for adjustment. What will life going to look like as the future begins to unfold? And also to emotionally relocate the deceased and to move on with life. This is not to say that they will not care for or love that person anymore. It does not mean this person is not important to them anymore. But what we're saying is our life will no longer be able to revolve around this person or this event. And because of that, we need to start making changes now to help that process along. And I believe whenever you can help a client to work through these 4 goals in their grief counseling, the great strides of healthiness can come into their life. What I'd like to do now is just go over some practical tips for those who grieve, some things we can do for them in counseling. One thing we want to do is encourage discussions about the death or loss before they occur. If they are aware of something negative about to happen, if they are aware of a death is about to occur, we want to get them talking about it now. We don't want them waiting until after the death occurred before they begin to deal with it. Because once again, as we're seeing from some different studies, the more in which we talk about the death before it happens, or the more we deal with the grief before it happens, the better the person is able to move on with their life. Also, to make it known that expressing emotions is good and acceptable. I think sometimes with our clientele who are children, there are times when it comes up where their parents may discourage them from crying or showing their emotions, even when it comes to the emotion of anger. I think once again, especially when it comes to children, they need to have the freedom and the ability to express their emotion, to realize it's a good thing, that there's nothing wrong with crying. There's nothing wrong with them being upset or being disappointed about what's going on, but once again providing an avenue where they can express these emotions and talk about what's going on with them. Also being able to handle them expressing their emotions. I think for therapists this is very, very important for us, that if we're not comfortable with having a client cry and wail before us in a counseling session, then we may be in the wrong field. If there are people who are going to be emotionally distraught when they're expressing their emotions about their lost loved one, and we need to be able to handle that. That we need to not try to shut them down quickly. That we don't need to make them feel like they can't cry. That we want them to be able to feel like they can express whatever emotion they need to, as long as they are appropriate. And so give them that ability, and you be comfortable with that. Also, gently challenge irrational beliefs. You have clients who may make statements like, you know what, I can't live without this person, I can't move on. Well, obviously that statement is irrational. Gently help them there. Gently challenge them to see what the truth is for their situation. That they can move on. That they can have a new life without this person, even though it will not be easy. We want to remind them of that. Also be willing to back off a subject when necessary. One thing that happens usually after someone dies, the loved one who's left behind has done nothing but for the past 2 or 3 weeks talk about that person who has died. And so maybe they come to your counseling session, their only thing they want to do that day is to talk to you, but to talk to you about a totally different topic. I don't think this is necessarily a bad thing. Sometimes clients will do that not to get off topic or get off subject, but they'll do this because they're simply tired of talking about the death or loss. And so once again, providing them an opportunity, a place to deal with something different may give them an opportunity to give a break from this relationship they're in, and then be able to come back to that at a different point in time. Also determine if the client needs practical help. Well, when it comes to food situations, things like that, financial support, things of that nature, maybe your case manager can be working with your client at that point to see if there's any physical needs that they need to have met. We know all from Maslow's hierarchy of needs that if those basic needs are not met, then we're not going to be able to get to self-actualization and help these clients with the counseling that they need. And so we want to make sure that their basic needs are being met first. And so we might just want to ask some questions during this time of grief if there's anything that they need. Also, we don't want to discourage any of the grieving rituals. There may be times that where the person is being encouraged by their family not to go to a funeral, things like that, or go to a viewing of the body. I think those are very important times, very important growth periods for the client. And so we want to give them an opportunity to grieve. And so we want to do everything in our power to encourage them to be a part of that grieving process, to go to that grieving ritual, because once those things happen, they may lose an opportunity to ever do that again. Also, want to help the counselees understand the grief process. You may actually want to take them and let them look at Elisabeth Kubler-Ross's work to talk about those different steps in grieving and death, to help them to see where they are and to normalize for them what are some of the situations they may find themselves when it comes emotionally and physically as they're dealing with the loss. Also, encouraging them to talk about good memories. What are some good things that they did with this person? What are some happy times they had together? Recall those things. Talk about those things. You may then see some tears of joy they shed because they are able to have some fond memories of the time that they had together that may help them in the healing process. And most importantly, I would say encourage talk about the future. We want our clients to be future oriented. Obviously, they'll be in the past some as they think about the past without this person, but we want their minds focused on what's going to happen tomorrow, what's going to happen in the future with you because your relationship has now changed. We want them to be looking towards the future. Some useful techniques I've used before and other therapists will have suggested. One of them is the use of symbols. Maybe having your client bring something to the session that reminds them of that lost loved one and be able to talk about that. It may be a necklace or a favorite picture they have with them, but something that reminds them of that loved one. We want them to bring those in and to talk about those things. Also, writing letters to the deceased. I've seen this been very helpful for clients, especially when they have some anger issues towards a person who has died. Maybe there's something they want to get off their chest and they never had an opportunity to say this to this person before they died. One way of dealing with this is to get them to write out everything they possibly can think of that they had a problem with that person. We can get them to either read that in a session a couple of times to kind of process that letter, and when that person gets ready to be able to bury and deal with this issue, we may even take them to a place and allow them to bury this letter or to burn this letter to kind of symbolize some closure they want to have with the client. But once again, you want to use this if it could be helpful. Also, suggest the use of a grief journal. Basically, with this grief journal, you will allow your clients an opportunity to basically say whatever they need to say about this person and how they're dealing with it. And so to talk about the emotions and the anger they had today, or the sadness and the tears they experienced today, but to keep a log of every day what's happening with them and to periodically go back and look at where they've been emotionally. Also with children, I think one thing that can be very helpful is giving them an opportunity to draw and express themselves that way. Maybe it's the grandparents' house who they went to during every summer and one of their favorite fishing trips they went on. Being able to draw this picture of a happy time with them and to maybe keep that picture hung up in their room, and every time they begin to miss their grandparent, they can go back and see this picture to remind them of a happy time together. Also, some role playing could work as well. I would caution you to be careful with this technique if you've never practiced it before. But basically what I try to do is find out as much as I possibly can about the lost loved one, and then I become that person for them in the session. Basically, I can talk to their client as their loved one to give them a place to express their emotions about that person before they've gone or now that they're gone, and I can respond back to them in the as the person. And so this could be very helpful to help in the grieving process with your clients. Also, identifying damaging self-talk. Clients will say, "No, I will never be loved again." Things like that. Some of that irrational beliefs. We once again want them to see the truth of the situation. We want to help them through these irrational beliefs so they can believe in the right thing and so their emotions can be changed as well. Also, a memory book I think can be very exciting. Many people do a lot of scrapbooking things these days. It could be a thing where they go back and get old pictures of this person to put together maybe a collage or some pictures of some great memories they had together. And this may be something where once a year, maybe on the anniversary of that person's death or maybe on that person's birthday, they can bring this memory book out to keep this person's memory alive with them, to help symbolize this person never really has fully left them. Another thing we can do is some directed imagery. Well, basically, some people use like an open chair, using an open chair technique, where they will basically talk to the chair as if that person was there. It helps them to deal with their emotions and to discuss once again with that person how they may have felt about them, even though they're not there anymore. But these are just a few ideas of some things you can do to once again to help this process of grief to be something that can be positive for your clients. Now, when it comes to some bibliotherapy that you can use, here are some great books I would suggest for you to look at, and also some books you can suggest to your clients after you've read through them. Obviously, Elisabeth Kubler-Ross's book on death and dying, I think, is a very good resource for both you and your client to get some better understanding about the process of grief and loss, and to help them to get better understand their emotions that they're going to be dealing with. Also, Stephen Levine, which I think is very neat, he worked with Elisabeth Kubler-Ross. She helped him in the writing of his book and also wrote the foreword for this book. In Unintended Sorrow, what happens in this book, we see him talking about other types of grief and loss that people experience outside of death, and then once again how to deal with it. Another prolific writer is C.S. Lewis. He wrote a book called A Grief Observed. Basically, in this book, he talks about and accounts for a time when his wife had cancer and when she passed away, and how he dealt with his grief in her passing. And the way he words and talks about the grief he experiences is very beautiful. I believe both you and your clients can get a great deal out of it. William Young, he is another newer writer. He wrote the book called The Shack. In this book, he basically talks about a little girl who is kidnapped and murdered, and how that child's father dealt with her dying and how he dealt with her grief. And so this man finds a shack in which she was murdered in and spends a weekend there kind of processing her death. It is such a great story to see how this man in this book deals with the grief and the loss of his child. Also, if you do some background information on William Young to find out about his childhood, you can really see how his own personal grief and loss really tied into this book. For some of you that may have religious clients, the book by Philip Yancey called Where is God When It Hurts talks about how do you deal with the religious aspects of grief and loss when you think you're being punished by God, or when you think God is ignoring you in that process. And so these are a few books I would suggest to you. Well, it's my hope that you've been able to learn a little bit more about grief and loss, and especially in the counseling field as we deal with our clientele. I hope that some of these books here that are presented to you will give you a lot better insight on how to deal with your clients as they experience loss in their life.